Pinaki. So glad that you can be here and really tell us what you're working on with Hindsait. You know, we talked a couple years ago at another event, and you really explained to me how you're working on cutting wasteful spending in healthcare. So tell me about what you've built and what you're working on now.
Absolutely, Logan. It's a pleasure. First and foremost, it's about 2 years since we are out in a beautiful setting like this, so really enjoying it. Hindsait has evolved over the years. Today, of course, the key theme that we looked at was nearly $1 trillion spent in healthcare is wasteful. And this is the JAMA study that came in 2019, $935 billion to be exact is wasteful. And the reason being, overutilizations, care gap, care coordination issues, data issues, so on and so forth. And one of the key pieces that we have seen early on is the data in healthcare. 80% of the data is stuck in medical record. These are the encounter report, visit report, inpatient records, lab, and there is no way you can extract the data unless you use the latest technologies like natural language processing, which is what we do, and we are helping payers to address overutilizations, wastage, human errors, and abuse.
Is there a way to make financial waste sort of more personal so that people can understand the impact globally? It can feel like something that administrators are dealing with, but I know it has a patient impact.
Absolutely. So think of this way, right? I mean, in US healthcare today, 18 to 20% of our GDP is spent on healthcare. That's the highest in the world. What if we take out, and it's $4 trillion. So you take that $1 trillion wasteful spending, it could be used in greater goods. And rather than spending that dollar in sick care, what if we transform that and make it to better healthcare, right? It's ensuring that the patient don't end up in ER, don't end up in hospital. The care could be rendered in their home, right?
Yeah.
And that $1 trillion savings could change many things in our society. That's that one.
Yeah. Okay, so we can all get behind the issue of wasteful spending, break it down in terms we can understand of what you've built. How are you actually tackling that issue at Hindsait?
So, the way today it gets addressed is health insurance companies. They actually review and audit all these medical records to ensure the coding was done right, to ensure that there are no overutilizations. So they do it pre-service as well as post-service. Pre-service are like prior authorizations. So if you need an MRI scan or CT scan, which may cost $1,500, they want to make sure that this is necessary. And many cases, it could actually expose the patient with radiation, which may not be useful, right? It could be actually harmful for the patient. So you want to avoid those overutilization. So they would get into the record and see whether it was necessary. We are automating that process. We are augmenting that process. Rather than flipping through hundreds of thousand pages, we are taking the clinical reviewers to that particular page number 820, where that particular information is stored, and we are showing them, yes, it met the clinical necessity criteria, or it didn't.
How has that worked over the years? I mean, what kind of success metrics have you seen?
So we have seen typically, the reviews which can take days can now be done in our platform in minutes.
Oh, wow.
And some of the overutilization, particularly imaging studies, a lot of their genetics study that gets done today, because sometimes we Google it and say, hey, we have a genetic disposition and we need to do that genetic test. Now, question is, was that necessary, right? And that's what our algorithm does. It actually fetches the information and matches against the clinical criteria guidelines and say, yes, it is or it isn't. And that entire thing could get done in a matter of minutes as opposed to flipping through pages. And the other side of the fence is by declining those claims which were unnecessary, you are actually saving the health plans millions of dollars in overutilization or overpayment.
Which then hopefully trickles down to the patient, who's able to have lower premiums, lowering costs, opening up access reaching those global goals. So you've been in the market for 8 years, and this has been a rapidly evolving space. And I wonder if you could just help us, with some of the wisdom you've gained, particularly over the last 2 or 3 years as things have changed so much. How have you seen health innovation evolve in the last few years?
Yeah, so I think the COVID, one thing COVID had shown is digitization is the path forward, right? So today we see, when we started, of course, AI, machine intelligence, and natural language processing, those were fancy terms. People didn't know how to deal with it, how to utilize it. But COVID had shown that evidence-based, and evidence lies in the data. So if you can do evidence-based treatment, evidence-based, care, that's kind of the path forward. So one of the things that we have learned is, of course, our core technology is clinical natural language processing, which is to extract information from that unstructured data. So what if we, make it open to large set of users like providers, like pharmaceutical companies and other technology companies? And that's where we came up with our on-demand clinical natural language processing technology via an API.
Okay.
Anybody can access and upload medical record and will get a structured feed. So what I'm excited about is now taking that on-demand CNLP API to our fellow entrepreneurs, technology company, which I think they can build more such use cases in population health, in the quality, and they could cater to a large section of the population, and that's where I see tremendous value that COVID has opened up.
That's really cool. That's a trend that I've been seeing over the last year, is that companies that are themselves very innovative are becoming enablers of additional innovation. They're becoming platforms for innovation, or ecosystems even. So you by taking your big data and opening it up from using an API, folks here at this conference who are thinking about accessing that information can kind of leap forward, right?
Absolutely, and so we are actually now targeting a lot of our fellow entrepreneurs who are building their own specific niche application use cases. They could use our CNLP API and build application on top and cater to a broad swath of the population who need such innovations, such insights from data.
I love it. Pinaki, I love what you're building. Appreciate getting to talk with you today, and I hope it is an awesome 2022.
Thank you, Logan. Really appreciate that.